Hello and welcome to another week. This week and next week, we are focusing on interprofessional or interdisciplinary collaboration. So, today we'll explore the intersection of adult gerontology nurse practitioners or nurse practitioner program and physical therapists. So, we'll focus on how this interprofessional collaboration directly impacts patient outcomes, especially the older adults, physical activity, and fall prevention strategies. Interprofessional collaboration is a fundamental standard of practice, which is endorsed by the World Health Organization and also the Institute of Medicine. So, by working together, the AGNPs and PTs directly contribute to the triple aim in which we ensure, patients receive cost-effective, for example, and highly efficient care for our aging population. Midwestern University has a specific stand on interprofessional communication. I believe you read about the One Health initiative, in which we are not only looking at the human health, but we are also looking at other, animal health and environmental health and how they all work together to influence health outcomes. So, for example, the interprofessional education collaborative established like some competencies which help to standardize this practice. What does this have to do with AGNPs? For example, we can collaborate with PTs, and in this helps in understanding, your own scope, maintaining mutual respect, and communicating effectively with physical therapists. And one more thing is to know when you can do a referral, which we'll come back to. So this is a visual of that synergy between the AGNP and PT, which is, complementary. While we manage as nurse practitioners in general, we manage medical complexities and diagnose conditions and update or adjust medications. So physical therapists specialize in restoring physical function and mobility. So together, we create a comprehensive care plan addressing both medical and physical independence of the patients. So during the residency, you have a physical therapist, expert who will come and talk to you more about this synergy. So physical activity is essential, medicine for all adults. While unfortunately, very few, I believe it's 12% of the older adults meet those recommended physical activity guidelines. So as AGNPs, you can screen for readiness or assess those patients, look at their musculoskeletal or functional limitations, and then you can refer them to PTs for intensity or, appropriate intensity or duration of exercise that they need to overcome the conditioning and maybe fall risks. So there is this collaborative that I've been talking about under the CDC's steady algorithm. So we can quickly identify patients for risks during maybe a wellness visit or even a routine visit, follow-up visits. And if they have moderate to high risks, and then we can do a direct referral to a physical therapist, which is very essential. And we don't only think about the referral, we can also do a consult with them. And then after we send a referral, the PT will then implement some functional training to reduce future falls. When you start working at the clinic, you will most likely have a referral department, but as a provider, you have to initiate those referrals and put them in the system. But what happens next is that they are usually sent by the referral department staff. At least that's what used to happen when I was working at the clinic. So, functional focused care approach is a four-step approach, as you see on the slide, which is designed to prevent functional decline, especially during the care transition from the hospital to home. So this requires, most importantly, working together between AGNPs and the PT. And of course, we have to involve the family caregivers, which seamlessly aligns their goals and encourage continuous and safe physical activity throughout their recovery process. This is a quick case study. Consider this is Miss Green. She's 80 years old, recently discharged from the hospital after, a 4-day pneumonia. So at her follow-up, you are the provider seeing her as an AGNP, and then you note that she's very frail. While conducting your functional screenings or evaluation, like timed up or stand up and go test, so you identify that she has fall risk. She's lacking coordination, and you can see that she's struggling to walk as you assess her gait. So this prompts you to initiate that referral, for example, to home health physical therapy. If possible, it can also be in the clinical setting like outpatient. So the intervention by PT follows your referral, and then they also have to do their own assessments. For example, they would do Miss Green's home environment, and they start her own evidence-based exercise program. So then they can do 10 sessions focusing on strength and balance. In this case, there is a lot going on in the background, like negotiating with the insurance, doing prior authorization to see whether all those 10 days are covered. And Miss Green then just regains her independence and confidently transitions to a community-based silver sneakers exercise program. So effective collaboration requires, good communication. Approximately 2/3 of Sentinel events are linked to communication breakdowns between different departments or different providers. So what we can use to improve that on that communication is the ESPER, which you're already aware of. You use it when you're handing off a report between you and a non-accounting nurse at the bedside, or a report to the physician while they are doing rounds. So this also, another one is team steps, which you probably never heard of, but it also works between AGNPs and PTs or other specialties when you want to share critical patient updates as quickly as possible by ensuring that everyone is on the exact same page. and patient safety is strictly maintained. So our collaboration, interprofessional collaboration, is significantly improving patient outcomes, which is our ultimate goal. So research has shown that when nurse practitioners and physical therapists work closely together, patients experience fewer errors and they end up staying at the hospital for shorter, uh, for fewer days. And they experience much higher likelihood of maintaining their functional independence and overall quality of life as they age. So this is the end of our quick overview about the interprofessional collaboration between nurse practitioners and physical therapists. And if you have any questions, don't hesitate to ask me, or you can also ask, you have an opportunity to ask the physical therapist expert who will be there during the residency. So let's continue leveraging each other's expertise between nurse practitioners and other experts so that we can work together to promote functioning in older adults. Thank you for your time. Let me know if you have any questions about this.